Hello everyone, my name is Caitlin Doomer and I am currently a fourth year pharmacy student on an academic rotation here at Concordia University, Wisconsin School of Pharmacy. Today I'm going to talk about what CMS Star Ratings are. Here are the objectives I would like you to be able to answer by the end of this mini lecture. This will also serve as the outline for the rest of the lecture. Alright, let's begin. So before we start talking about what CMS Star Ratings are, we need to define what CMS is. CMS stands for the Centers for Medicare and Medicaid Services. They are a federal agency that runs the Medicare program. In addition, CMS works with states to run the Medicaid program. CMS works to make sure that the beneficiaries in these programs can get high quality health care. So what is a CMS Star Rating? It is a tool that is used to measure Medicare beneficiaries' experience with their health plans and the healthcare system. A health plan's rating is based on different measures in 5 categories: staying healthy through screenings, tests, and vaccines, managing chronic conditions, member experience with health plan, member complaints and changes in the health plan's performance, and health plan customer service. The goals of CMS Star Ratings are to implement provisions of the Affordable Care Act, clarify program requirements, strengthen beneficiary protections, and strengthen CMS's ability to distinguish stronger health plans for participation in Medicare Part C and D, and to remove consistently poor performers. Some beneficiaries of the CMS Star Ratings for providers are improved patient relations, improved health plan relations, increased awareness of patient safety issues, greater focus on preventative medicine and early disease detection, and strong benefits to support chronic condition management. As for members, benefits include improved relations with their doctors, greater health plan focus on access to care, increased levels of customer service, and a greater focus on preventative services for peace of mind, early detection, and healthcare that matches the individual needs. Now let's talk about how CMS Star Ratings work with Part D plans. The purpose of Star Ratings with Part D plans is to indicate the quality of Medicare plans that are for beneficiaries. They are based on a scale of 1 to 5, with 5 stars being the highest rating. The overall star rating is determined via performance measures across several domains of performance. There are 4 domains that are measured in Part D plans. They are drug plan customer service, member complaints and changes in drug plan's performance, member experience with drug plan, and drug safety and accuracy of drug pricing. We will go over these in detail in the next few slides. The first domain is drug plan customer service, and it covers call center, appeals auto forward, and appeals upheld. Call center is where there is defined by the percent of time that TTY services and foreign language interpretation were available when needed by people who called the drug plan's prospective enrollee customer service line. Appeals auto forward is the percent of plan members who failed to get a timely response when they made an appeal request to the drug plan about a decision to refuse or payment or coverage. Appeals upheld is how often an independent reviewer thought the drug plan's decision to deny an appeal was fair. This includes appeals made by plan members and out-of-network providers. The next domain is member complaints and changes in the drug plan's performance. This includes complaints about drug plan, which is the percent of members filing complaints with Medicare about the drug plan, members choosing to leave the plan, which is the percent of plan members who choose to leave the plan, and lastly, drug plan quality improvement. And this shows how much the drug plan's performance has improved or declined over the year to the next year. If a plan receives 1 or 2 stars, it means on average the plan's scores declined or had gotten worse. If a plan receives 3 stars, it means it's on average. The plan scores stayed the same over the years. If a plan receives 4 or 5 stars, it means on average the plan scores improved. Keep in mind that a plan is already doing well in most areas but may not show improvement. It is also possible that a plan can start with low ratings, show a lot of improvement, and still not be performing well. The next domain is members' experience with the drug. And this includes rating of drug plan and getting needed prescription drugs. The rating of drug plans is the percent of the best possible score the plan earned from the members who rated the prescription drug plan. And getting needed prescription drugs is the percent of the best possible score the plan earned on how easy it is for members to get the prescription drugs they needed using the plan. The last domain is the drug safety and accuracy of drug pricing. This is really where pharmacists can play a huge role. In the MPF price accuracy, this is a score comparing the prices members actually pay for their drugs to the drug prices the plan provided by Medicare's Plan Finder website. Higher the scores are better because they mean the plan provided more accurate prices. The next three categories are very similar. The first one is medication adherence for diabetes medications, which is a percent of plan members with a prescription for diabetes medications who fill their prescription often enough to cover 80% or more of the time they are supposed to be taking the medication. The next box is medication adherence for hypertension, which just has the same definition as the diabetes one right before it. And the same goes for the medication adherence for cholesterol or use of or taking statin medications. Pharmacies have a tool within their computer system to pull star ratings on how well their pharmacy is doing with covering adherence for these three different types of medications: diabetes, hypertension, and cholesterol. For example, McKesson uses Outcomes MTM as their service to pull star ratings on pharmacies. They can pull data from all their Medicare patients, and the data that they do pull is about their medications, their fill histories, and indications if they're listed on the patient's profile. This data is compiled to give a star rating on adherence, so you can tell how well a patient is taking it based on their fill dates. From the star rating, a pharmacist can complete a CMR review to help increase patient use of the medication, as well as make sure they're on the proper medications. We'll see an example of this later on. So how exactly are plans measured besides just the medications that are being used? Plans are measured by the percent of Medicare Part D beneficiaries who are 18 years and older who adhere to their prescribed drug therapy for diabetes, hypertension, and/or hyperlipidemia. This percentage is calculated as the number of member years of enrolled beneficiaries 18 years and older, with a proportion of days covered at 80% or higher for medications during the measurement period, divided by the number of member years of enrolled beneficiaries 18 years and older with at least 2 blood pressure medication fills on unique dates of service during the measurement. The proportion of days covered is the percent of days in the measurement period that is covered by a prescription claims from the same medication or another in its therapeutic category. Beneficiaries are only included in the measure calculation if the first fill of the medication occurs at least 91 days before the end of the enrollment period. The Part D medication adherence measures is adapted from the medication adherence proportion of days covered through the Pharmacy Quality Alliance. Cut points are important when looking at the star ratings. They are described as a specified value used to sort continuous variables into discrete categories. It may be set according to its usefulness in predicting abnormal clinical events or just arbitrarily. In regards to CMS Star Ratings, they are parameters used when assigning star ratings to the domains. Let's see an example of this. In this example, we are looking at a proportion of days covered for statins. A person is filling a script for atorvastatin 40 milligrams with directions to take 1 tablet by mouth every day for a quantity and day supply of 30. We know their last fill date is July 1st and the current fill date is August 5th. To find the proportion of days covered, we take the number of days the patient has had medications and divide by the total number of days between fills. Because this is a percent, we will need to multiply by 100. In this example, the patient had Total days for medication is 30, divided by the days in between the fill date, which is 36. Now, because this is a percent, we will have to multiply by 100. For this patient, they had medication covered for 83% of the time. Now let's apply it to the CMS Star rating for statins. If the patient had a Medicare Advantage prescription drug plan, they would be considered to have 4 stars. If they have a prescription drug plan, they would be considered to have 3 stars. This is a great opportunity for pharmacists to have them sit down with the patient, complete a CMR, and talk about the importance of adherence. Pharmacists can help increase star ratings by doing CMR reviews and documenting that they happened. If you don't document it, it didn't happen. And if it didn't happen, you don't get paid. If you don't document it, you can't measure outcomes. And if you can't measure outcomes, you don't get credit for providing great care. Ultimately, we, meaning the pharmacists and Medicare, are doing this to help improve the health outcomes of patients. So now that we've talked about what CMS star ratings are and how you can measure them, what is the impact that star ratings have on health plans? So star ratings can help enrollees to compare quality and performance among plans. They will have a star rating for each of the 4 domains through prescription drugs. So for drug plan customer service, it's how well the plan handles member calls and questions. For member complaints and changes in the drug plan's performance, how often members had problems with the plan. This includes how much the plan's performance had improved, if at all, over time. The third is a member experience with the drug plan, so just basically members rating the plan of how they felt the use of it was. And lastly, the drug safety and accuracy of drug pricing, which is how accurate the plan's pricing information is and how often members with certain medical conditions are prescribed drugs in a way that is safer and clinically recommended for their condition. For overall prescription drug coverage, quality information comes from member surveys, billing, and other information that plans submit to Medicare and Medicare's regularly monitoring activity. So in summary, CMS star ratings are ultimately for the patient. There are many ways to determine a star rating, and one of the best ways to improve a star rating is to do so through documenting. I would like to thank you for listening to this mini lecture on CMS star ratings. If you have any questions, please feel free to reach out. My email is listed below.